All right.
Excellent.
So good morning. Thank you, Keith. And tough act to follow, Dr. Friedman and Dr. Clay. But I guess in typical fashion, I will demonstrate that I'm a bit of the rebel in the group because I will not be starting my presentation by referencing any laws. I am just going to talk about what we're doing at Rady Children. So to provide a little bit of an idea of the flow of my presentation, I'll give you a little bit of context about Rady Children's, our digital strategy. We'll talk obviously about the COVID crisis and what I'm calling that was then, this is now, and how we're moving forward. So Rady Children's, not going to spend a lot of time here, but we are the region's provider of choice and safety net for pediatric care for San Diego, Riverside, Southern Riverside, and Imperial counties. And you can see some of the stats here as far as what things look like from a COVID standpoint. This is data as of Monday. But as you can see, it's not looking good, and the numbers are probably for San Diego alone are just as big as they are for the entire Germany. And I have not kept up with what things look like in your neck of the woods, but certainly it's not looking pretty in the U.S. And you can see here cumulative data, what our counties look like, and California has this tiered, color tiered method of sensing risk, and you can see that the bulk of San Diego, Riverside, Southern Riverside, and Imperial counties is showing purple, which is the riskiest of the tiers. We have some trending views here of cases by month, tests completed and positive, hospitalizations and death. Again, not pretty data. We have some data here that is stratified by age groups. And again, I mean, you can see the trends. Same thing by hospitalizations and deaths. And this one here is for Baja California. And I should mention that Josh Karummel, who's our chief data officer, does a tremendous job of compiling all the data produced by the county and by Baja California government, and kind of presents it to us on a daily basis. So we can keep a finger on the pulse. But having provided you a little bit of context, let me shift gears to what we're here to talk about, which is our digital strategy. And I guess I want to pause for a second and ask you all, what was your digital strategy a year ago, right? So put yourself on December 2019 and think about what was your digital strategy then. And we're going to play a little game of bingo. And let me see if you can make a row or the full chart here. We have EHR, we have HIE, we have AI, we have personal health records, we have CRM, Internet of Things, patient-generated content, RPA, chatbots, robots, telemedicine, patient portal, you name it. Can anybody call bingo? So this is what Rady Children's look like. Of all those things on the bingo card, we had a number of them that we were intending to continue optimizing. They'd been in place for a long time, and our main goal was to continue to optimize in this virtuous continuing improvement cycle. Then we had things that we wanted to scale. We had started playing with them, but they weren't widely adopted. And so we wanted to scale. And then there were things that we wanted to start playing with, chatbots, RPA, whatnot. So all of this was driven by the board, the CEO, CIO, other. Well, in our case, this is where we were at that point. But we were facing a lot of barriers, right? And we were facing financial barriers, technological barriers, cultural barriers, regulatory barriers, and really all of the above. But I wanted to talk a little bit about telemedicine, and kind of you will see a parallel here with what Dr. Friedman shared earlier that was going on at UCSD. And we're a little behind. Dr. Friedman has had a center of excellence for telemedicine for decades. We were not as advanced early on, but telemedicine was a big initiative for us, and what we wanted to do was to enable it, right? But we were facing some barriers, and at the time it wasn't so much financial, technological, or regulatory. Really, cultural was the biggest one, right? And the one that was at the forefront. And when you asked your average clinician what they thought about telemedicine, those of you who've studied Latin know that they said vade retro, which means turn away, right? Not for me. Thank you. You're all familiar with the Gartner's hype cycle, which in this case for telemedicine, we've been throughout. I would say at this point we're probably here at the peak of inflated expectations. There is a trough of disillusionment and enlightenment and productivity. I don't think we're quite there yet, but I think that is quickly coming. Now, COVID happened, and as the wise men said, never waste a crisis. So come March, and we're doing business, and our volumes were kind of on par for what we expected, and COVID hit. And suddenly all that denial about telemedicine, when the volumes immediately dropped, when the governor gave us a stay-at-home order, turned into seeing the light, and telemedicine became the solution. Right here, you see, we've been doing telemedicine since 2016. And by the way, you'll see that I'm showing 2021, and that's because this shows fiscal year, and our fiscal year started in July. But you can see that in the first 6 months of this year, we've already done more telemedicine than in the entire year prior, and certainly a heck of a lot more than in the prior 3 years. So that was our one thing, right? Our one thing was telemedicine. Well, telemedicine and remote work, and that is part of our digital health strategy, is enabling our workforce to function. So we've gone to producing telemedicine across all specialties. Right. What drove that change at this point was not the board, was not your CEO, your CIO. It was really COVID. Right. Now, all those barriers that we discussed earlier, they were gone. They were gone because we didn't have a choice. Right. Here you can again see more volume data. We have data showing volume by department, by actual physicians. We can trend it by geographic area. And we've really switched. Now we're at telemedicine is in our optimize phase. We've still are piloting a number of things and scaling other things, but as far as optimizing, what we've done is we've started asking our patients when they have their visit. At the end, there's a brief survey that asks them how was their experience. And what you see is that 89% of those patients would recommend telemedicine. And over 93% say that it saved them time. We look at it by department. We look at it. We also ask what went well and what if they run into any issues and what would make it better. So we ask them what those reasons are, and you can see the word puzzles here. We track whether we get reimbursed, and as you can see, our denials are relatively minimal and no different from our normal business. We project our visits for the next 7 days. And we do this for specialty as well as for primary care. We can look at lots and lots of data, but we're at a different point now, and we've gone from really a technology-driven digital strategy to a situational-driven technology strategy, where it was external factors that drove it, to a place where now our board is driving the technology strategy. Right? And not only is our board driving our technology strategy, our CEO is 100% behind our digital strategy. And obviously I continue to be, and pretty much everybody else around the organization is in alignment now. So what does our strategy look like? Well, our digital strategy looks like this. We need to redesign care to ensure that we provide the right care at the right place, at the right time. And we want to enable a workforce of the future. So that means seamless care delivery that closes the gaps and reduces disparity in care. As you know, Dr. Friedman talked about this, the US healthcare system has great disparities in care, in part because of the way it is financed, and obviously we want our care redesign to help reduce those disparities. We want to support the needs of our patients, the pediatric world, which is not just the kids but their families as well. We see this as an opportunity to open new markets. We want to fully engage and empower our patients and their families, and obviously we want to find new efficiencies. Now we've set up a number of guiding principles, right? We want to be nimble. We want to ensure that we are caring for the whole child, and that means not only their physical health, but also their mental health. Right? We want to make sure that whatever we put in place is scalable, and we want to make sure that we are focused not just on the patients, but also on our employees. Now, the scope of care redesign includes a set of clinical paths that must focus on the things that we normally do, but specifically on complex chronic care in the home, as well as high acuity care in the home, not just kind of a replacement for traditional ambulatory strategies. And we also want to make sure that we are, as I noted, reducing disparities, ensuring outcomes, in really optimizing our clinical teams. The elements that we see enabling care redesign involve changes in practice. It involves a paradigm shift in the culture and access for our patients. It involves, obviously, tools and technology. It involves ensuring quality outcomes and sustainability, enhancing our infrastructure, and as I noted earlier, reducing disparities. That's more detail on the same themes, but as you can see, very consistent with our policy. I've shown you this slide earlier, right? It's definitely showing that our volumes are here to stay when it comes down to digital. And now that the vaccine is here, and like UCSD, we've been kind of vaccinating our frontline staff now for a couple of days with the Pfizer vaccine. We're expecting the Moderna vaccine to come in the next couple of days. We've vaccinated. As of last night, we're a little bit over 450 employees and medical staff. We'll ask the question, what will the new normal look like? And what we've seen is we've gone from an average of 4 telemedicine visits per day to, at the peak, about 800 visits per day. Right, which was a 200 time growth. And now that things have stabilized, we're looking at about 400 visits per day or so. So the truth is we are not going back. This is here to stay. And the question that follows is, what about the workforce? Right? We know that we had this satellite hit, this comet called COVID hit us, and we needed to ensure that we were not only able to take care of our patients, but we were also able to support our workforce, who in many cases are having to stay at home because the schools are closed, and they have kids that need to do remote schooling, or we're dealing with staff that have conditions that put them in a high risk category, and they need to be able to do their work remotely, etc. So what does a digital workforce mean for us? Well, it means a remote work, both full-time remote as well as part-time remote. It means supporting alternate schedules. It means providing toolkits and education, both for staff and their leaders, to support remote work. It means setting up wellness and support resources for those staff. It means we now have to both recruit and onboard people virtually. We have, since this whole thing started, now we have a not insignificant percentage of our workforce that has never set foot on our campuses, right? That have never met face to face in real person, or shaken hands with their teammates or their direct supervisor, right? And obviously, we've had to dream of different ways of engaging our workforce in a way that we hadn't dreamed of before, right? Most of our engagement activities involve bringing people together and having big celebrations and meetings and symposia and all kinds of things, which now all happens digitally. So our path forward to a workforce of the future involves some key themes, right? And those key themes are people and culture, right? We need to be able to preserve that culture, and doing that in a virtual world is definitely challenging, and we've had to get creative for that. It involves ensuring that we have paths and avenues for growth and development, right? Looking over the shoulder of somebody, how they used to do things, being able to pop one's head into the neighbor's office and say, hey, I'm struggling with this. Can you help me out? It's different. Now we need to make those taps digitally and that support digitally. We need to rethink our compensation and benefits. California has a very high cost of living, but as more and more staff are able to work remotely, and maybe they're choosing to move to other locales where the cost of living is lower, does that mean we need to reassess our compensation, since those folks no longer have to sustain the high cost of living in California? Obviously, we're needing to develop new policies and procedures. We're deploying new technology that supports remote work. And we are rethinking our use of infrastructure. Does this mean that our physical footprint, easy for me to say, our our physical footprint will be able to compress a little bit, and maybe our expanse in real estate might not grow at the pace that it had been growing. Here you have more detail on what I just talked about. And here I'm just showing you that as you can see, we do have quite a bit of remote work. We track it, quantify our access, and ultimately the bottom line is that was then, this is now. It was then when we deal with patients, and it is now when we deal with patients, and it was then when we deal with remote workforce, and it is now when we deal with a remote workforce. And you can see that practically everybody does some level of remote work. Not necessarily every day of the week, not necessarily all hours of the day, but you can see here that pretty much every single one of our users does some level of remote work. So this is San Diego. Never let the truth get in the way of a good story. I'm going to say it's 72 and sunny, contrary to Dr. Clay's claim that it's going to rain. I know it's going to rain, but I think we have blue skies ahead, and so in order for us to continue to thrive in that environment, we are going to proceed with our digital strategy that drives the right care, the right place, at the right time, and that drives a workforce of the future. Digital health, both from a telemedicine front, from a remote work front, is here to stay. And so all I have to say at this point is welcome to the 21st century. And with that, vielen Dank.